Hello and good afternoon. This is Midweek Vibes. We are so delighted to be back this afternoon, and it's my joy and privilege to be your host today. And my name is Reverend Maggie Moher, and we are coming to you live on YouTube from Mamlaka Hill Chapel, Ruaka. And today is a great day, and we are very, very privileged, and it's my joy and honor this afternoon to introduce to you our guest. And I would like him to introduce himself so that we get to hear this from the horse's mouth. So Dr. Hamisi, please, go ahead and introduce yourself.
Sally, thank you so much for the invitation to come to Mamlaka Church. My name is Dr. Hamisi Koteali. I am a chiropractor specialized in fascia manipulation. Chiropractic means done by hand. So we assess the spine, and then we use our hands to realign the spine to relieve pain or any discomfort that one may have. Fascia manipulation, on the other hand, it's a skin underneath our skin. Like when you eat meat, there's this white or shiny stuff you see as you're cutting meat that looks like a nylon. That's the fascia, and the fascia kind of gives us a map of the human body. And I specialize in that map of the human body and how that body works with the skeletal system to cause us pain and dysfunction.
Our interest is actually pain, and we want to know why we have pain every time, everywhere, or some parts of our body. But before you do that, you've talked about fascia.
Yes.
Before you tell me what fascia is, what is this? What is this prop here?
Maybe I need to stand and
yes.
And we go to it. So here I have two prompts that I wanted to bring so that I can make this explanation easier. One is that we all have studied the skeletal system.
Yeah, we are more familiar with that.
Yes. Everybody knows about the skeletal system, and everybody knows about the muscular system. You know, we all know how when you look at a chart of the muscles, you'll see something close to this.
Yes.
You know, however, in between these two, we have something else that nobody pays attention to, and that's the fascia tissue. The fascia tissue is the elasticity, is the elastic part that you see if I pull this, you see we have this. Muscles don't pull like this. So what makes them pull like this? It's that nylon that we see in meat. You know, when you slaughter a goat, men will always push with their fist the skin as they're removing it. And the ladies, when they open up, when they get the meat and they're trying to make food for us, as they're cutting the meat, there is always that nylon thing that is like slippery. That is the fascia.
So where do we find it?
So the fascia is in our entire body. Everywhere in our body, we have fascia tissue, because the fascia kind of encapsulates the muscles, the nerves, the ligaments, the blood vessels, and the bones. So all these things are encased within the fascia. So when the fascia gets tight, for example, can you lift your hands together, up all the way? You see how easy that is? Put it down. Now let's assume that she's playing football or she's playing netball and she sprained her knee, okay? And the fascia here gets a kink. So, you know, maybe somebody stepped on her, and the fascia here gets a kink. Now, lift your hands again. Can you see the difference?
This seems to be a strain.
You can see a strain on this side. Okay? So even if I held this here, and I told her to, first of all, let me ask her to walk. Just walk a little bit forward. See how easy that is to walk?
Right.
Come back. Now, if we now put our kink, and I asked her to walk, just walk.
There's some difficulty there, I noticed.
See there's a strain.
Yes.
You can see there's a limb.
Yes, there's a limb.
Come back. So that's what fascia does. Fascia, whenever we have an injury, it wrinkles, and unless it's unwrinkled, it stays that way for life. Okay, and the fascia is the only tissue in our body that we say it's malleable. It can change. It can change its form in whatever age, in a child, and in even an older person. Number one. Number two, as when you look at the fascia at the body, we know that the body can get injured in two ways.
Right.
Way number one is, for example, trauma. For example, what I was showing you,
Yeah.
a knee injury.
Yeah.
That knee injury can cause trauma, that can cause compensation. For example, if I hold this knee here, so, and then she develops a shoulder pain, it's unless I release this, this shoulder pain can never be pain-free. If it goes pain-free, it goes somewhere else.
So what you're saying is that when one part of the body is injured, not that pain from that part can go to other parts of the body?
Over time, this will heal. This will heal. Maybe this injury would have been in high school, for example.
Right.
Yeah, she had her knee in high school when she was playing sports. But now she's an adult. She's working. She's a mom, for example, and she's not doing much as an office job,
Right.
which means she's always here.
Right.
Okay. So, because of the posture in the office, because of sitting all the time, and this being shorter, this shoulder will not work the same as this. So we get a strain here like you were getting, and that over time might make her to get what? Shoulder pain. They get like what we call shoulder impingement. You hear people have rotator cuff pain. Shoulder is or frozen shoulder. So this shoulder, if it's only treated here, yes, it will get better, but it will compensate. This, plus it may now start hurting on
Other
the hip.
parts.
On the hip. For example, it can be like this. Let me
From
show you.
shoulder.
Let me show you. Let me show you. We have that. Then we have the shoulder here.
So it's coming from the knee to the shoulder.
Yes. You see what happens to her posture?
Right.
You can see her posture, she cannot be upright.
So you can't.
So all that tension causes a spinal shift here, this way. Okay? And we know here we only have muscles and the and this spine and the nerves. So if we push the spine this way from the compensation, the nerves here and the discs will start getting a lot of pressure, which will result into a backache. So that will be a secondary, a compensation that, now a back pain is a compensation from these two. So if you again just come to treat the back, and come maybe and let's say we do surgery or we do therapy here, it will never go away fully if you don't release.
Because we have not gone to where the problem started.
You get, that's one way. That is when we have an injury, we have a trauma, or we have an injury on the musculoskeletal system. The other way we get sick.
But just before you go there,
Yes.
my grandmother, for example, used to say that her bones are aching.
Yes.
And put her hand at the back there.
Yes, to try and be upright. To try and be
what was
upright.
aching that? What is it?
It's the same fascia tissue getting stiffer. You see, because she doesn't want to be here, when she does her hands here, you get like a support, then it's able for you to be upright. When your hands are here, you'll be able to bend more. But when she puts them here, she gets a relief on the back, and she feels like she can be able to look forward. Otherwise, she'll be like this. You understand? She will, if she doesn't put her hands here, she'll feel like this. So she'll walk. You get, but when she puts her hands here, she gets balance, number one. Number two, she gets to be able to orientate her head so that she can look forward where she's going.
But her structure has certainly been affected very negatively because she's no longer upright.
Yeah, the structure gets compensates over time because, as I said, the fascia keeps on folding. It's like a foil paper. It keeps on getting wrinkled and wrinkled and wrinkled. And the more it gets wrinkled, the more the body pulls. Why does it do that? Because our body is like the traditional jiko, 3 stones. Okay, let me explain that. The leg here, we have the big toe, we have the heel, and you have the small toe. Those are the only 3 parts that step for us. So to give us a 3D, to give us that support to stand.
Right.
Okay, that 3D stand is what helps us to be able to move, to bend forward and back, side and side, rotation.
Okay, I have another question.
So
my very same grandmother, and I'm sure other grandmothers in the village, lie down on the carpet or on the grass outside and ask a young child to step on their back. What's happening there?
Because you see now, for example, let's use that shoulder. This was stiff and this is stiff. So here is very stiff.
Yes.
So it's painful. Okay? But if you massage, if you step on it, you loosen the fascia.
So they're trying to intervene.
Yes, they're trying to loosen the fascia because when the fascia is a bit relaxed, the pressure, the nerve pain is less. But but because this pull is still there, this relief is short-lived.
It's short-lived, yeah.
Yes, yes.
Oh, thank you for that explanation.
Yes.
Wow, Dr. Hamisi, let me invite you to take a seat a little.
Yeah, let me just, I wanted to finish for you the second part
Okay, please.
So the other way that we get sick is, for example, when you have a child, a newborn baby, for example, and this newborn baby is getting recurrent fevers or recurring sinus, whatever it is, or tonsillitis. If they, let me use fever. If they're getting a lot of recurrent fever, they'll also end up with tonsillitis. Now, when you get tonsillitis, that tonsillitis will cause an inflammation of the entire lymphatic system. What is the lymphatic system? It's the immune system. Because of these constant infections. So it gets inflamed.
That's right, yeah.
So these children, as they are growing up, they start developing dental issues. They'll start getting either
So
cavities.
fever is,
Yes, the fever is what started.
the fever
Yes, but
to inflammation, now
inflammation,
to the dental.
then to the dental, and then
What?
from the dental, they will get gas or acidity or bloating. And then if it's a girl, they'll get painful menses. Okay? Painful menses, irregular menses, maybe too light, maybe too clotty or too heavy. It can be either. So now as a young girl, the mother or the parent will take her to the doctor.
Yeah, sure.
The doctor will try to do what is called hormonal balance. You try to normalize your cycle so that you have less pain. So the doctor gives you what? A pill. A family planning pill. The family planning pill will regulate your hormones so that your cycle is better, but the fascia keeps on what? Stiffening. So the fascia here stiffens. So you develop a low backache. And that's why ladies, when they're having their menstrual, they're in pain. They develop low back pain. So this stiffness here will continue for some time. Will continue for time. You get your children.
Yeah.
You make another grave mistake. You have a surgery here.
Oh,
Okay?
sounds like more trouble here.
Yes, more trouble because that surgery will do this. Okay? So you have painful menses.
The back?
The back is it doesn't bother you maybe ukifua. Lakini after the surgery now, the back, you realize you have a back problem.
What?
Okay? And then this back problem, you may do something and then it feels like it's relieved, but it will shift to the knees.
Okay.
The knees will start hurting either on the inside or on the outside, either when you're going upstairs or when you're going downstairs.
Right.
Okay? And then that may also be treated and go away, and then you develop this. In the morning, you can't step.
I've heard of people who can't step in the morning.
Yes, in the morning you can't step, but after a few minutes, it's okay.
Yeah.
You're fine. If that's not the case, you develop migraine. Either here, here, or here. Okay, you start developing these headaches. Why? Because again, remember you had fevers.
Yes.
And you had tonsillitis. They are all here. So this fascia here is also stiff.
What?
You get? That's what will cause a lot of tension onto the head. Okay? So that will make the head go like this.
Uh-oh.
Yeah, you find they'll be like this. This patient, they'll be like this, and then the pelvis will be like this. Why? They are also again office jobs. And then this patient of ours, after their 8 to 5 job, they jump into their car or they get into their matatu.
Yeah.
Another sitting.
Yes.
They go home. You get to your favorite sofa set, sit down, put your legs up, and start ordering, your children.
Yeah.
You understand?
Yeah.
And this
We know that routine.
this goes on for a long time.
Yeah.
Remember we said there was acidity here.
Yes.
This acidity keeps on increasing. Now to a point now you're no longer taking over the counter, you need to go and get help. So you go to see a doctor. And the doctor will do examination and test and then realize, hey, you have H. pylori as a problem.
Okay.
Okay? So if this H. pylori as a problem, you'll be put on Nexium. But you see, the acidity is not, yes,
it's not a standalone.
It's not exactly, it's not a standalone. It's not just the bacteria.
Yes.
You understand? So this acidity will never go away. You'll take first kit of Nexium, you feel great, and some time you're fine.
Right.
And then after some time, it's back.
It comes back.
It comes back. So you may end up developing, you say, you know what, now I know what to be doing. So you be going over the counter and you keep on
Getting more
keep
stuff.
on buying stuff
Yeah.
to relieve a symptom, not the problem.
That's a symptom.
This is a symptom. This symptom can transform to give you constipation because again, here is stiff because of the painful menses and because of the surgery. So you can start having what? Constipation. Okay? When you start having constipation, you get more stiff. The legs become more stiff. And then you start developing this. You know, you always want someone to massage.
To massage your shoulders.
Yeah? If not, you're getting numbness, tingling. But when you go to a hospital or to see a doctor, they will do an X-ray of the neck, and they will definitely see a lot of degeneration because of the neck having been like this for so long. It will cause a lot of wear and tear and nerve pressure. Okay, so the doctor again will start treating this.
So let's talk about you now. When we come to you.
So for us, the difference between us is that you know, we don't look at the body as parts. We look at a human being as a whole. Okay, that's number one. Number two, we work to recreate balance of three things. One is the structure, that is the spinal
skeletal structure.
The skeleton and the muscular. So the fascia and the skeleton have to be balanced. So the weight distribution from left to right has to be balanced. If you're like this, there's trouble. Number one. Number two is to is what you put, is the fuel, is what you eat. Because what you eat is what controls the metabolism, is what moves these two.
Yes.
Okay? So we also need to look at what is it that you eat. A lot of people, unfortunately, today, a lot of young people are just eating Indomie. I can't, you know, it's gonna be a disaster in a few years to come. It's gonna be a huge disaster. Because, you know, you're not putting anything here that is of value. Because the Indomie that you're eating, it's all wheat. And we know a lot of wheat. Wheat has a lot of gluten. And we know gluten is number one increase of inflammation. And inflammation is why we get sick. So, so whatever you put here determines how this works. So for example, if you're eating a lot of Indomie and you already had these injuries, or you used to have sinus or tonsillitis, the inflammation in you keeps on building.
Right.
Okay? So you get to 40 and you're diabetic. Okay? Or you get to 45 something and you're diabetic and hypertensive. And they're like, how did I get it? But it's because, one, the structure was stiff. The metabolism you're putting in is poor. It's not giving us the nutrition we need. And the third part is the emotion. The emotion, what we call emotion, is what makes us move. Okay? Whatever makes us move is a current. It's called chi. Chi, it's an energy, it's a current. It's like our body is like flowing in fluid. It's flowing in fluid. It always has to be gliding. Okay? Whenever the body glides, it produces static electricity. That static electricity is called piezo energy or piezo current. That piezo is that current that is life. That's what we breathe. If that piezo does not happen, you're dead.
Right.
So this sliding and moving creates the energy. So if your body is so stiff because you're like this, just stay like this for a second, and then you're stiff here, you're stiff there, you're stiff uku, okay? Your mobility is very limited. So your amount of energy that you need, okay, the amount of energy you need to generate, or rather to supply the whole body has been reduced. Not only the energy, but because of all these tightening, internally, you're also compressing the heart, the lungs, the intestines, everything, but inside there is working on a tight spot, a tight space. But what we know is that all these organs, when they were created, they had enough bathing space.
Right.
They had enough space for them to move freely. Now, whenever they get squeezed, constrained, their functionality is impaired, then they start, that's when you start developing what? Inflammation, and that inflammation now becomes a disease. You get, which is now what is a pathology that can be seen on an X-ray or an MRI.
Right.
However, the fascia tissue or the fascia restrictions are not seen in an MRI or an X-ray.
So how do you see them?
You can see them on an ultrasound, But the best way to test for fascia restriction is function, is movement. You want to test movement. You want to see, can your patient, for example, can your patient do a squat? Can your patient bend forward? Can your patient extend backwards? Can your patient turn? And then you want to see which one of these movements are highly compromised. You get? And then you combine the compromised movement with the history, with the functional scans that you took to see how the body is distributing weight, and also to see the muscle tension, you know, like, turn like this. So, yeah, just face this way. So, so back here, we have these vertebrae and the nerves, okay? Now, if the tension is so much here, then the nerve flow, it's impaired. And you know, the nerve has, the information has to come from outside the body to the spinal cord, to the brain for interpretation and a feedback out. You get? So if it's all restricted, the information to the brain is distorted, okay? Meaning the organ that has a lot of pressure may not even be represented properly here because the signal that is sending are confusing. So the body will be trying to see, I cannot pick the kidney, where is it? So how can I compensate to pick the kidney? So the body will develop a cyst, the body will develop either a cyst, a tumor, something will grow to try and create space. You get? To try and create space on the inside so that each organ can again
move freely.
Yes.
Wow. Thank you so much, Dr. I think we are on time for a short break.
Sounds good.
We're going to take a break, but when we come back, we're going to look at a couple of issues that are before us, and one of them is the common types of pains.
Okay.
So stand by. Stand by. We'll be back in a minute.
Ewe Mungu wa majeshi, ninapenda kukaa nawe, maskani zako zapendeza, nazikondea kwa shauku kubwa. Heri siku moja mbele zako kuliko siku elfu mbali na wewe. E Bwana, nguvu na msaada wangu, takupenda daima. Vyote Baba, lakini nikupate wewe. Heri siku moja mbele zako kuliko siku elfu mbali na wewe. Daima. Heri siku moja mbele zako kuliko siku elfu mbali na wewe. E Bwana, nguvu na msaada wangu,
Welcome back, guys. It's good to have you back, and I'm so delighted that you're watching. And we wanted to pick up with Dr. Hamisi the common sources of pain or causes of pain. What is known from medical study, history, case studies to be the common causes of pain that people experience? Let's start there.
It's the back.
Yeah.
The low back is the low back, even in our practice, is the most common thing that brings people. So low back pain is really, really big. After low back pain, it's the knees. After the knees, it's the neck. And then after the neck, I find leg and headache. And then you can get shoulders, and then you get wrist, and then the elbows will come in between. But for this to happen, it's all most of the time it comes from the balance between right and left. A lot of it will come from the balance right and left. Remember what I said about the three parts that step. So we step with this part,
Right.
we step with the heel, and we step with this other part. So it forms a triangle. Okay. Now these three parts, as I said, is like the traditional the fireplace.
Right.
The 3 stones.
Yes.
You cannot cook with that traditional 3-stone fireplace if one stone is shorter.
Right.
The sufuria will give you a problem.
Yes.
Yes. So it's the same. So whenever there is so if somebody has either a very high arc, the arch is this one, this here. If this high arc is very high, it's going to cause a problem here, or a problem on the back, problem on the neck, or problem on the shoulder. If it's too flat, it's still going to cause a problem. Okay? That's number one. Number two, it's if it rolls in. If
Right.
it rolls in, whenever you step, your foot rolls in like that, it will always cause back problem. The next one, it's if it rolls out. You know, there are people who, when they walk, they look like they're stepping like this.
On the outside.
Yes.
Yes.
Again, that one will also cause the back to hurt. And then we have other people, when they walk, they sweep everything in their way. You know, they sweep everything in their way. That also will cause a back and knee problem. But what I want you to understand is that a problem in one part compensates the whole structure. That is the most important part that you need to understand. Why? Because this structure of the human body is malleable. It's supposed to be flexible, moving easily. So whenever there's a restriction, or there's this, so for example, if my foot is like this, then my movement is limited. It gets limited. So if my movement is limited, and I'm supposed to walk like this, for so long, the discs here will start crying after some time. They will complain. Why? Because that movement is causing a lot of rotation here, and that rotation is causing these discs that are separating the vertebrae. Because this is, you see the white big ones are the
Right.
vertebrae of the back. The small spacers are the discs.
Right.
So are the ones that make these bones not to grind on each other and the nerve not to be compressed. So if this movement is abnormal, the disc will wear out, and when the disc wear out, the nerve, which is the yellow one here, will be compressed. Why? Because when the discs wear out, they will protrude like this. That's why you see, oh, I was told my disc is herniated, my disc is out.
Right.
The MRI shows my discs are not aligned. And when it's like that, it's going to press this to the bone. And that's why you get either pain down the leg, or pain on the back, or pain. This one can happen anywhere.
Anywhere on
the spine.
skeleton.
Yes. So, and the reason why it happens like that, like back pain. You see, back pain. We normally treat the back most of the time, but most of the time, this area. Let me show you with her. Come. Facing, yeah, just face that way. You see, if you look at the back, you see this is a white triangle.
Right.
You can see that. And we also have the same triangle here.
Right.
Okay? Now, that triangle is very important. This is called for a Columba Fascia, or the fascia of the lower back. This fascia is
That's a better term to use.
Yeah?
Fascia of the lower back is
Fascia of the lower back, yes. This fascia of the lower back,
Yeah.
it's what holds us upright. Because At the back here, there's no bones. So the only bone is the spine. Okay?
Yes.
So this fascia, whenever it gets tight, it depends on how it pulls. So if it's tight this way, for example, if it's tight from this leg, it will cause problem in the shoulder.
Okay. Back and shoulder.
Yes.
Okay.
Most of the time, pain will either be here, or here, or here.
So if I come to you and I'm complaining of shoulder pain, so you won't look at the shoulder first?
No,
Because that's not where the source of the problem is.
No, because the difference between, as I say, the difference between us and modern medicine is that modern medicine is curative. You have pain here, you go, the doctor assesses you, we treat the pain.
Right.
Us is more preventive. We look at the functionality of the entire system. Okay? So if you come to me with shoulder pain and back pain, or just shoulder pain, I want to know, when was the first time you had it? The very, very first time you experienced that pain. And I want to know what happened that time you experienced. Is it just came on its own? Did you get heat? Or was just, if it's just on its own, I need to ask more questions.
Right.
I need to ask, before this shoulder pain came, did you have any other pain anywhere else
in your body?
Yes. Either still current, that you're not, it's there, but it's something I'm used to it. And once I get that, so for example, you may say, my knee, but hiyo inisumbuagi, hiyo, I'm okay with it.
So,
me, I'll go to the knee.
You go to the knee. But I have a question there.
Yes.
So why do people tend to tolerate pain?
It's because you try a lot of things and it doesn't go away. When you try a lot of, you see, you try, let's say you take painkillers, you do procedures, you do therapy, it gets better, but then it's back. So when this happened so often,
Back and forth.
you get to a point you're like, you know what, I may just as well live with it.
So we choose to live with it.
People
Is
choose
that
to
what
live
you
with it.
call chronic pain?
Yes, yes.
So let me hear from you, the kind of patients that come to your clinic. What kind of patients are they? Are those ones with chronic pains, or are they the ones that have just had a pain recently?
Actually,
or a mixture of both?
Actually, what is interesting is that everyone comes to our office, but the clients that I've seen get what I say and understand what I'm saying are people above 50.
So they come after 50?
No. I'm saying the patients who are above 50 understand what I'm saying.
Oh, I understand. Okay.
They get what I'm saying. They listen.
Why?
The people below 50 are still in running around trying different things. The people after 50, they have had these pains for so long, they have taken medication, they have done procedures, they have seen doctors, and now they're in a place like, you know what, I'm going to live with it. So if you give them a different approach, if you give them a different way, they want to listen. And when you start explaining what you're doing and following what you're doing, it makes sense with them because they have gone through the stages.
So say something to the young people.
What I want to say is that most of the young people are Google doctors. As much as Google is informative, remember that everybody can post in Google. Anybody can post in Google, and if Google was all we needed, we would not have medical schools.
Right.
So it's important that you go and see a physician, a medical doctor or a clinical officer, somebody trained in the medical field, because one, they have a deeper understanding beyond the Google. Number one. So when you go to see this person, yes, you have Googled and you have your information, but give that other person who has trained in that area, who has not looked at it when they had. Give them time for them to give you a diagnosis. Be open-minded. Don't be so rigid, and don't just be so quick in doing, complex things. Most of the young people like complex. I went and had this surgery, like they just want to do crazy things without thinking, what would that be for me 5 years, 10 years, and when I'm above 50? Because when you get to 50, that's when you realize that's when life really kicks in, because everything now that was able to compensate with the fascia tissue does not bulge. Does not bulge. There's no more compensation.
So
now it's
on your
pain.
own.
Yes, now it's pain.
It's pain, yeah.
Yes, now it's pain. And with this pain robs you one critical thing, mobility. If you look at people above 90, and even when they are being measured, what made them live longer, it is not by looking of an MRI. It's looking at function. What is their cognitive function? What is their physical function? Because the physical function determines cognitive function. And cognitive function determines physical
The
function.
physical function.
So the two work together.
Yeah.
So when you are able to maintain mobility to your older life, that you have maybe same mobility that you had when you were 23, you have a better chance that if God blesses you to live to 100 years, you'll be able to have your faculties, you'll be able to be independent, you'll be able to move. That's why we do what we do. For us, we're looking at the future. We are looking at when you're aging. Like now, you see, as Africans, we are not people who are supposed to be taking our parents to nursing homes. It is not in our culture.
Yeah,
in our culture,
right.
we are supposed to take care of our parents.
Right.
However, because of economic hardships and lack of employment and many, many other things, we are not able to do that. So now we are taking our parents to nursing home. But if you go to a nursing home, you'll be surprised. Most of these people, they have such a small problem of mobility that if you are able to help them, they will be independent and staying in their own houses, in their own homes, and doing their own things. I'm saying that because in my clinic, my oldest patient is 99.
Say what?
Yes, my oldest patient is 99. I think she's also a member of your church. Not here, though. And this lady, when we started with her about 5 years ago, she was here. Okay? Today, she's like this. If I had permission, I would show you her, her image and her progress. She's now upright.
Wow.
She's upright. She doesn't need a cane. She carries it just in case she loses balance. But she doesn't need a cane
At
like
99?
this. No, she doesn't.
Wow.
And this is somebody who has had both knees replaced, both hips replaced.
Oh, okay.
Yes. So you can see she was really stiff by the time we started working with her. And once we were able to get her mobility back, it doesn't mean that she's 100% off any problems.
Right.
But it means she's able to travel, she's able to work, she's able to play with her grandkids. She's able
Right.
to, you know what is happening when you get to 50 and you're all restricted with mobility. You complain so much about pain that everybody you live with are used to it. Okay? So you're saying in pain,
So they don't pay much attention.
no, they don't pay attention to you.
Yeah.
So you'll get now to a point, we have now to get a wheelchair, tutakuwa tunakuandika nje, alafu tunakurudisha ndani. You have to get diapers, just because you lost one thing, mobility.
Mobility.
Yes.
So talk to us about ensuring we don't ever lose our mobility.
Okay.
When we are young,
Yes.
what do we need to start working on now, if you're not already doing that, to ensure that we don't lose our mobility and we can have a better quality of life when we are older?
Number one, we have to say there are 5 causes of chronic illness. And these 5 causes of chronic illness are so simple and we ignore them all the time because they're with us all the time. One is sleep. If you notice you're waking up all the time between 1 and 3, and you're a young person, you need to do something about it. That has to be fixed. Because we know that when we get into that very deep sleep, it's the time that our body does repair.
Right.
It's the time for repair. So if you are not able to get to that deep sleep, your body does not get full.
Full repair.
Number one. Number 2 is when you're getting acidity. When you get acidity that is recurrent, it's telling you something is causing an imbalance in the body. There's inflammation somewhere. There's something that is happening that is not correct. That needs to be addressed. And not just addressed as acidity here. We need to know what would be the cause of the acidity, not just the symptom. The other one is gas and bloating. Sometimes you just eat something, you may eat a chapati, you may eat a skuma, you're getting a lot of gas and bloating. And it's continuous for some time. That needs to be addressed. Then the other one, so acidity, gas, and constipation. When you're constipated, it's even worse. Because constipation, when we eat food, there's a time that the food is supposed to get in the mouth and come out. If that time is extended, meaning we change the human clock on how the physiological function of every part of the body works, then you have a delay.
Right.
When you have a delay, it means then you're going to get acid, you're going to get gas, because food is staying in one place longer than it should. You understand? You're going to get bloated, you're going to get gassy because fermentation is taking longer than it should. Okay? So constipation, and then when you're constipated for very often, what happens is that, you know, the intestines will still keep on sipping nutrients.
Right.
So when you're constipated, the body would be trying to sip dirt. Okay? We say that whenever that happens, and it happens for a long time, the lining of the gut, which has poles like a kichungi, these poles become a bit wider. It's what is called leaky gut. Okay? Meaning when it's a little bit wider, it's allowing larger particles
To get
of
into the
macronutrients to get into the bloodstream. That's why you're always tired. You know, like, oh, I am tired. And it's in the morning, it's Monday morning. You were from a weekend, you're tired. So some of that happens. Now that, when this goes on and on and on, causes more inflammation in the body. The other one is stress. Stress. So there are 5. Acidity, gas and bloating, constipation, stress,
Sleep.
and sleep. Okay?
So stress now is the last one.
Yes.
Yeah.
Stress, on the other hand, whenever we are very stressed, the body produces a lot of inflammation. You know, the body is producing a lot of inflammation. That's why you get so pumped up whenever you are getting stressed out. But the body is creating this massive inflammation. This massive inflammation causes this guy to
tighten up.
Yes, because this guy is not one. These are several layers. There's the layer that next to the muscle, and there's another layer we call the superficial fascia. In the superficial fascia is where all body physiological functions happen. The lymph of the body, where the immune system will occur. You know, also even the return of deoxygenated blood, most of it will be near the superficial fascia. So whenever this superficial fascia gets tight, because the return of these fluids is not having a lot of pump like oxygenated blood, okay? Because the heart is pumping oxygenated blood. But this other one depends on your movement and depends on how tissue is free. So if your tissue is very stiff and you have very little movement, miguu, because the return is slower.
Oh, swollen feet.
Yes, you start getting a lot of feet swelling. Miguu yangu inafuraga lakini sijui kwa nini. You know? But you know, sometimes people start linking it with the kidney. But from my experience, and I've done this for maybe now 21 years, if the superficial fascia is tight, you're going to get swelling of the feet.
Okay.
Yeah.
Wow. Thank you so much. I think we have a few more minutes to learn one more last thing before we end our amazing session. I'm just thinking about COVID-19. Because it's our COVID-19 season, we can't avoid it. And it's doing stuff to the lungs. Is it touching the fascia?
You know, yes. When last year we had our first case of COVID-19, I wanted really to follow a lot to understand it. Because you know, as a practitioner, I'm seeing patients every day. One thing that I noted about every patient who spoke about their experience, they said they felt their lungs like they were glasses. There were things like glasses that were cutting them on the inside. When I heard that, something went into my head, ting, 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 which says, whatever, for our body to grind like this, we have a fluid, which is called hydrochloric acid. Okay, we call it HA. This fluid is the fluid that whenever we have stiffness or an injury, it's what gets stuck. It sticks the fascia together, the layers of the fascia together. When the layers of the fascia are linked together, they don't what?
They don't move freely.
They don't grind. So you lose grind. So what I've seen, because now I'm starting to see a lot of patients who are recovering from COVID-19, what I'm seeing is that this patient, they develop a lot of stiffness
on the chest.
On the chest, okay? But remember, most of the ones who are really getting affected are ones who have a pre-existing condition. So meaning if you have a diabetes or you have a hypertension, your body is already inflamed. It's already under inflammation. Now, when you get the virus triples the inflammation. Yes, it triples the inflammation that you have. Now, this tripling of the inflammation, it's like it's affecting what? This hydrochloric acid, the grinding. So the tissues are stuck. The chest becomes very tight. And not only the chest, if you look at the lungs have a very clear film on the outside. That film is also fascia. And that film is where the lungs are able to move. So if also that gets what? Like stiff. Okay? Now, let's go inside the lungs. Inside the lungs from the airway, as we are going in, we're gonna from the trachea all the way to the very small sacs in the lungs that where oxygenation happens. We have things that are like hair, like they're like wings. They always do like this. So they propel out mucus and any dust you inhale. Now, when the fascia gets stiff, what is happening is that the flexibility of this fascia, of this cilia, it becomes stiff. So they don't move. Okay?
Right.
When they don't move, you get covered, and you're breathing, and your body is producing mucus. The whole lining of the whole lining of the lungs get filled with the mucus because you're not able to remove it. One, because when you're trying to cough, it's very painful because the fascia is very stiff. So when you can't cough, it's extremely painful. Okay, so what happens now? What happens is that when these things are filled with mucus, you need oxygen. You cannot breathe now because the cilia is not helping you to clear the mucus. So meaning the alveolar sacs are not able to get the oxygen.
The oxygen they need. Yeah.
So you need to get a ventilator to help with oxygen. Okay. Now, when this goes on for some time, then this mucus will get infected. Okay. When this mucus get infected, then you get a pneumonia, and that's what will kill you. Okay? But if you survive, if you survive the COVID, the fascia, remember, is still stiff and it's superficial. Mostly it's the superficial, not the skeletal. It's the superficial one. So it's still tight.
Right.
So when it's still tight, it will be very tight. Then your oxygen concentration will be trouble because still the lungs are still
not able
they're
to.
still lungs. They're still held.
Yes.
So you'll need to do things to help the lungs loosen this.
Right.
For your lungs to do what? To get that mobility. If you're not lucky to get somebody who can help you with breathing exercise and movement, then it becomes difficult for you to get back your oxygen concentration, number one. Number two, these same patients are developing foot drop.
What is that? What is foot drop?
Foot drop is where you are not able to do your foot like this. So when you walk, instead of you being able to lift your foot, you... So because you don't want to go pulling, so they step like this. You know, when they walk, you'll step funny because your foot wants to drag, but you don't want it to drag, so you lift it in an abnormal way.
Right.
And when you lift, you bang it. It's like you bang. They walk like they're banging the foot down. So you may be like, how does that connect with this?
Yeah.
It connects with that because the fascia of the lungs, the meridian of the lungs, follows the same pattern with the leg, okay? And the leg muscles that does what?
That flexes that part.
So if you get a really serious attack, and the fascia is all stiff, it's going to cause stiffness not only there, but also huku na ivute. So if you had another, let's say you had a back problem before, and you had a sciatic problem that may be healed, and this one now you got COVID, you can be sure a foot drop will be most likely to happen. Yeah, it will be most likely to happen.
Fantastic. Thank you so much. I was going to ask you, how do you correct that?
Oh.
Before we wind up, so we need to correct that problem.
Yes. So the human body has a map. Okay, God created a map for us. This map has points. Okay, has points all over that allows us to move this way, to move back, to move side, to move this way, to move this way. So for us is to examine and find which line or which sequence is restricted. Okay? And then we work to release those points. Once you release this point, it opens up back.
Oh, fantastic. Thank you so much. We are so grateful. That's what we had the time for today.
Thank you very much.
But we cannot thank you enough for that good information. And for our viewers, we thank you so much for staying with us. Keep sending your questions. We'll have a chance to look at them later. Send them to Dr. Hamisi who answer those questions. But I heard Dr. Hamisi said something about chi, the energy around us. Us as Christians, remember our energy, our strength, and the energy that moves us is the Spirit of God. God bless you. See you next time.
Thank you.